Hi YouTube, Kathy here. I'm coming at you with a video this week. I'm almost through the entire year-long process of getting ready for bariatric surgery. I was referred in August of 2013. I had my orientation at Windsor, Ontario Bariatric Assessment Clinic. And I was originally referred in May, but the orientation was in August. And I thought for some people that are just going through it, maybe I would give a little bit of a rundown of what I've gone through since then so that you have an idea what's coming down the road because there's a lot involved in it. So after my orientation in August, I received 2 appointments in September, at the end of September. One was a nurse consult and one was a clinical social worker consult. And at those appointments in September, the nurse just takes all your stats. She goes over all your medical history, gets all your medication, really just gives you the rundown about you. And then at the clinical social work consult, they talk about your attitudes towards food, what some of your triggers might be, and then they give you some homework. And that homework you have to do and have ready for your next appointment. And that is usually journaling and going to 2 support group meetings in your area. So be prepared for that. And then at those appointments, which I had September 26th, I was then given a nutrition class appointment, which took place October 15th. And now keep in mind, you can bring a support person with you to almost all of these appointments. If you want to bring somebody, your mother, your husband, your wife, was the case may be, whatever. And so October 15th, nutrition class, that's with a group of other people that are going through the process with you. And they go through all of basically the types of foods that you should be eating now, how you should pair proteins with carbs. They should have a couple of snacks and they should include a protein with a carb. Basically going through the food groups and making sure you understand all of that. And then a little bit about how you're going to eat after the surgery, with a very high focus on protein, of course. So after the October 15th nutrition class, which is about a 2-hour class, so it's not too long, then you get an appointment. I had an appointment for November 6th for the doctor's clinical examination. Now that's the first time that I meet, not the surgeon, just a bariatric doctor who specializes in it. And at that appointment, before you get there, you have a whole bunch of blood work that you have to do. And I mean a whole bunch of blood work. They took so much blood out of me, I was a little faint, actually. And so you take by the time you go to your doctor consult, you should have all the results of that, and your lab work should automatically be sent over to Windsor. But if not, always ask your doctor for copies of your tests to take with you. When you go for your meetings, you'll have a little green binder, and they give you a little appointment sheet that you can keep track of all of that's what I'm reading off of right now, but so you can keep track of all your appointments. So at the doctor's clinical exam, that was November 6th, approximately 3 months after my orientation. And he'll give you an EKG, check your heart rates and so on. Also at that doctor clinical exam, they're going to give you requisitions to have an abdominal ultrasound done and a sleep apnea test done. So you have to do those as well. And then you go back about a month later to see the social worker for a follow-up and show her your homework. So my follow-up was December 2nd with my social worker. I had to give her my journal, and she would read through it and, ask me questions based on what I wrote. And at that time, she's either going to sign off on you as being okay mentally for the surgery, or she's going to say you need a little bit more work, and she's going to actually have you do some more homework and some more mental work, and then come back for another follow-up. Now, I was lucky enough I was signed off at that point from the social worker. So December 2nd was my sign-off from the social worker. I also, December 2nd, had a registered dietitian one-on-one consultation. So the first one was the class with the group. Now, December 2nd, I had a registered dietitian consult. And That one, be prepared, because from the class, they quiz you on how much you remember from the class. And before you go see that dietitian consult, you have to do 6 days food journaling, specific everything you put in your body. And they're looking to see that you're pairing your carbs with your proteins. And I wasn't sometimes. So, stupid me. I was very honest about what I was doing. And stuff like Hamburger Helper is not good. Anyway, so I ended up having to have a follow-up with the dietitian. So I had more homework I needed to do in how I was eating. So I had another dietitian that was scheduled for later. So December 2nd, now they try and double up as many appointments as they can for the days that you're going to Windsor. I live near London, so it's a 2-hour commute for me either way, Toronto or Windsor. Even though I'm having my surgery in Toronto, I go to Windsor for all of my pre-op appointments. So December 2nd, I was signed off by the social worker, and I saw the dietitian, but I was given a follow-up that I needed to do. So that was December 2nd. Then, of course, Christmas happens. January, they don't seem to book too much in January, maybe because of the weather. So February 5th, I had my follow-up for the dietitian, as well as the doctor follow-up. And everyone gets the doctor follow-up, because then he reviews all of your tests, the sleep apnea, the ultrasounds, the EKGs, everything. And so I did the dietitian who follow up, and she signed off on me because finally I got it right. And then the same day I did the doctor follow up, and he reviewed all of my tests, all of my medications, and he signed off on me. So at that point is when they're okay to send your file to Toronto. First, though, you then have to come into a surgery education class. So my surgery education class was February 20th. And then that's, again, a group setting with everyone that's going through the process. And, you know, if you're going to Toronto to have the surgery done, everybody in your class will be going to Toronto. If you're going to Hamilton, everybody in your class will be going to Hamilton, because each hospital has slightly different processes on what they allow and don't allow pre and post-op. So I'm going to Toronto Western. So I was with everybody that's going to Toronto Western. And my surgery education class on February 20th is a 2-hour class again. Really, they go a little bit more in depth about how you're going to be eating after surgery, how they're going to, the process they're going to go through in the hospital when it comes to all the gizmos you might have attached to you, the leg pumps that help you keep getting clots, and the medication they might give you for blood clots and so on, to prevent blood clots. And then after that 2-hour education, a surgery education class, your file is definitely within a week sent to the hospital, and you sit and wait. And you can wait anywhere from, as we were told in class, 4 to 6 weeks to hear from the hospital, the surgeon, for your appointment to go in and meet the surgeon. So that's where I am right now, and waiting for that call, and it's the waiting that hurts the most, right? As soon as you get that call to go meet the surgeon in 4 to 6 weeks, you have to be prepared at that point to purchase your OptiFast, which is approximately $100 a week. Depending how big you are, depends on how many weeks you have to be on OptiFast. Confession, I am 355 pounds, so for every 100 pounds that you are, you're going to have to do 1 week of OptiFast. So I'm looking at probably 3 weeks of OptiFast. So $300. And you buy it at that time when you go meet the surgeon, but that doesn't mean that you're going to have your surgery in 3 weeks. That just means you're buying it, you're getting ready, and then they'll give you a date. The date could be anywhere in the next few months from then. They might not give you the date right at the hospital. They might call you after that with a date. So again, you're waiting. When they call you with the date, then you start your OptiFast however many weeks before the surgery that you're supposed to be on OptiFast. OptiFast is just a really nasty shake. It's a protein shake, and you can only have 4 shakes a day. At Toronto, you can't eat anything else. You can drink broth and sugar-free Jell-O and sugar-free popsicles, but you cannot eat anything other than that. So that's going to be a little bit of a challenge for me. It's the one thing that I'm more worried about the OptiFast than I am the surgery. Even after surgery, I know that my stomach pouch is going to be so small. I'm not going to really want a whole amount of food, like a lot of food. At least I hope I won't, because I hear that the hunger stops for the first few months after surgery, other than this kind of hunger. So anyways, it's the OptiFast I'm worried about, and everybody seems to worry about it, and everybody seems to get through it, so I'm just going to take it as it comes. Anyways, I'm running really long. I'm at 10 minutes now. But I just thought I'd give everybody a big shout out, and hi to Deb RNY. Nice to see you. Nice to hear from you. And you're right in behind me, so hopefully I can give you a little bit of information as we go. And anyone else that needs any advice, or not even advice, but just some information about how things are going, leave me a message down below there, and I'll try and answer you. I'm starting to check my Facebook or my YouTube a little bit more. I also have a Facebook page as well. And that's about it. So I'm excited, and I'm almost through the entire process, getting ready for my surgery, and I can hardly wait. And I hope anyone else that's going through this with me is going to have a smooth journey and as little complications as possible. And I'll talk to y'all, probably the next time I post will be when I actually have a surgery date, or at least when I get to see the surgeon. So probably in another month or so. Anyway, it was nice talking to everybody, and we'll see you later. Bye.